Welcome back to the fifth and final installment of your Chapter 17 videos, looking at personality disorders. So, what is a personality disorder? Well, personality disorder is characterized by an inflexible pattern of thinking, feeling, or relating to others that cause problems for a person in their personal, social, and work situations. Personality disorders tend to emerge in late childhood or adolescence and in some cases, they might be milder versions of more serious or more severe disorders. So, for example, obsessive compulsive personality disorder is a milder version of obsessive compulsive disorder, as well as, schizoid and schizotypal personality disorders are characterized by symptoms similar to those of schizophrenia, but does not meet the full criteria. Now, personality disorders generally fall into three categories. So, those that are characterized by odd or eccentric behavior, those that are characterized by dramatic or erratic behavior, and finally, those that are characterized by anxious or inhibited behavior. What's common, though, to all PDs is the person's inability to understand and be sensitive to the motives or needs of others. So, in the DSM-5, they fall into these three clusters. So there's clusters A, B, and C. And so cluster A would be the odd or eccentric personality disorders, and they tend to be paranoid, schizoid, or schizotypal. We've got B, which is the dramatic, emotional, or erratic. And so in there we'll find like antisocial, borderline, histrionic, and narcissistic personality disorders. And then finally, cluster C, anxious or fearful, and that would be avoidant, dependent, and obsessive compulsive. Now, the way that I was taught in grad school is to remember these categories is that cluster A is the mad, cluster B is the bad, and cluster C is the sad personality disorders. Now, again, any characterization that you're using, the point is that just trying to kind of place some things into memory. But let's talk a little bit about them so that you kind of have a little bit of a flavor for them. So, cluster A, we've got paranoid personality disorder. And so, for people with this personality disorder, they have a pervasive mistrust of other people's. They're always suspicious of other people's motives. They doubt their friends or their partner's loyalty. They persistently bear grudges. They perceive attacks against their character very easily. For someone with a schizoid personality disorder, they tend to have this detachment from social relationships. They don't want or they don't enjoy close relationships. They get they have little sexual interest in others, little pleasure from activities. They're really indifferent to praise or criticism, and they really have a very flattened affect. Finally, schizotypal personality disorder. For these folks, they tend to have social and interpersonal deficits that are marked by a real discomfort with um, close relationships. So, whereas the schizoid folks really just don't care, people with schizotypal personality disorder, they're really uncomfortable in relationships and therefore they have a reduced capacity for them. They also tend to have odd beliefs and magical thinking and speech, lack of friends, and an excessive social anxiety due to paranoid fears as well. Now, when we get to cluster B, this is the dramatic and erratic, or the bad personality disorder. So here's what we got. So first off, we got antisocial personality disorder. This is where a person has an extreme disregard for and often will violate the rights of others. So this would be like law violations, aggression, reckless disregard for the safety of others, consistent irresponsibility. And antisocial personality disorder really is a key factor in criminality. Then we also move into borderline personality disorder. And in borderline, we tend to see there's an extreme instability of interpersonal relationships. So the relationships are intense and unstable. They do a lot of work to avoid being abandoned. There's a lot of mood instability and self damaging impulsivity. We have the histrionic personality, and this is someone who is very excessively emotional and they are attention seeking. They need to be the center of attention. They often engage in sexually seductive behavior. They have very rapid and shallow emotions, and they're quite theatrical. And then finally, narcissistic personality disorder. And these folks tend to think that they are very special, very self important. They require excessive admiration. They've got a sense of entitlement about their life because of how awesome they are, They tend to be interpersonally exploitative, and they really lack empathy for others. And we get to cluster C, the anxious and fearful. And so, in this particular category, we see avoidant personality disorder. And for a person with avoidant personality disorder, they have a lot of social inhibition, a lot of feelings of inadequacy, hypersensitivity. They won't get involved in something unless they're sure that they're liked, and they're very preoccupied with being criticized or rejected. Dependent personality disorder is similar to this, except for there's also an excessive need to be taken care of. They fear separation and they have a strong belief that they can't make it on their own. And in order to kind of keep the peace and make sure that they aren't being separated from or abandoned, they can't disagree with other people. And if they get out of one relationship, they will urgently find another new relationship because they need to be taken care of by someone. They can't do life on their own. Then finally, we have the obsessive compulsive personality disorder. And in this personality disorder, you tend to see that preoccupation with orderliness, perfectionism, and rigidity. They can't complete a project unless it's perfect. They're very devoted to work and productivity, and they're just real stubborn too. So you can see there's some of the flavors, I guess, of OCD there, but without that anxiety as the driving feature for behavior. Now, most disorders are best learned by case studies. So I'm going to give you an example here of someone quite famous. So I don't know if you recognize these photos here, but we are looking at the very beautiful and the very late Anna Nicole Smith. So let me tell you a little bit about her. So she dropped out of high school in her sophomore year, so in grade 10. And at age 17, she married a guy. So that was 1984. They had a child. They separated 2 years later. In 91, while working at a strip club, so she was 23 at the time, she met an 89-year-old billionaire. She married him at the age of 26, and he died 1 year later, but he didn't leave her in his will, even though he apparently made verbal promises that she would have up to half of his estate. In an interview with Larry King in 2002, she noted that she met this billionaire that she married, who she affectionately called Papa. And when she met him, he just looked, in her words, just very, very sick. And so there's always kind of been this presumption that perhaps she's been a little bit of a gold digger. She had a very successful modeling career, but spent a lot of time in the modeling career as well, suing companies for exploiting her sexuality. And yet that was actually the key kind of feature on which she marketed herself. She also spent the remainder of her life in court fighting her deceased husband's son for her portion of the estate. Um, she did her first Playboy cover in '92 at the age of 24. She completed 3 more covers since that time. In 2006, she posted a YouTube video, and in the YouTube video, she announced to the world that she was pregnant. 2 different partners contested the paternity rights. This was cleared up through the court system. She had her own TV show for a while. Um, Anna Nicole Smith really fits in many ways the criteria for borderline personality disorder. With her, you can see throughout her whole life that there is this pattern of unstable and intense relationships. There is a lot of high levels of self-damaging impulsivity. In fact, she died in 2007 due to an overdose on prescription medication. With her, you kind of really kind of see some of that flavor there of the personality disorder and the need to be loved and cared for as well. And so it's a very sad story, but a really poignant example for our purposes. Now, let's talk for a minute about diagnosing personality disorders. So first of all, there's several issues with diagnosing personality disorders. First off, accuracy. To get this right is a challenging thing because, again, there's no medical test to say, yep, that's the personality disorder. They've got the borderline gene or whatever, right? And so a lot of it is, again, that clinical interview and that clinical understanding of what a person is going through. The other thing, too, is that, again, like many other things, personality disorders are highly comorbid with each other. And the other thing here and this is really where it gets challenging, is that, you know, there's been some numbers that have been thrown around that the estimated percentage of people in the population with a personality disorder is as high as 15% of the population, which begs the question, are these things really disorders then, or are they just personality types, right? It's an important question to ask. And again, here's where we need to go back to that question of functional impairment, right? Is this leading to meaningful, clinically meaningful impairment in a person's life? If yes, then it's a personality disorder. If no, then it's probably just their personality. Now, we're going to talk a little bit about borderline and antisocial personality disorders because both of them have very important implications for behavior. So I hope this will kind of suss out a few things for you. So first of all, borderline personality disorder, BPD, mostly is diagnosed in women. It's often associated with suicide as well, and it's an internalizing disorder. So the behaviors are directed in general towards the self. Whereas antisocial personality disorder, or APD, occurs mostly in men, and it's the foundation of criminal behavior, and it's an externalizing disorder. So the behaviors are directed towards harming others. All right, so in borderline personality disorder, we talked a little bit about it, but it's a psychological disorder that's characterized by personality disturbance along with mood swings, unstable personal relationships, identity problems, threats of self destructive behavior, fears of abandonment, and impulsivity. BPD is widely diagnosed, occurring in up to 20% of all psychiatric patients. About three-quarters of diagnosed cases of BPD are women. Now, what are some of the symptoms? Well, there's the fear of being abandoned and a kind of a clinging dependency on others, a pattern of unstable and intense personal relationships. So we're swinging between I love you and I hate you, and that happens very quickly. Um, Oftentimes, people with BPD deal with stress by engaging in self destructive behaviors, and often these behaviors are designed to call forth kind of a saving response from another person. So, we're talking not only threats of suicide, but actual suicide attempts as well. For many people with BPD, they have a lot of identity disturbance. They have a very unstable self image, and they talk about having chronic feelings of emptiness or boredom. Now, BPD can be explained by both genetic and environmental roots. It is heritable, and people often have neurotransmitter imbalances. Many theories also focus on a disturbed early relationship between the child and his or her parents, that may contribute to BPD. Now, the dangers of BPD are also greater when they're associated with childhood sexual abuse, an early age of onset, substance abuse, and aggressive behaviors. Now, looking at an externalizing disorder, antisocial personality disorder is characterized by a disregard for the rights of others and a tendency to violate those rights without being concerned about doing so. It often begins in early childhood or early adolescence, and it continues into adulthood. APD is about 3 times more likely to be diagnosed in men than in women. And in order to get this diagnosis, you must be at least 18 years of age or older and have a documented history of conduct disorder before the age of 15. Now, some of the symptoms of APD include little distress or remorse for the pain that people cause others. Oftentimes, they will lie and engage in violence against animals and other people. They frequently have drug or alcohol abuse problems. They're egocentric and frequently impulsive. And the intensity of antisocial symptoms tend to peak during the 20s and then decrease over time. So, usually by the time a person's hitting their 50s or 60s, they're beginning to mellow out. Well, not really beginning, they're mellowing out, and hopefully things are kind of getting a little bit better. Now, again, with APD, there's lots of biological and environmental factors, right? There's a genetic predisposition, and there's biological abnormalities that are seen amongst those with this disorder, but also environmental risks such as neglect and having an abusive parenting style can impact the likelihood of APD developing in a child. So here again, we see kind of this, both, whether it's kind of internalizing or externalizing, that in both of these cases, there are some real needs for people with these disorders. And you can see here that we've got this interplay again between genetics and between environment, and that both of those play a role in the development of things such including personality disorders. Now, I'm really looking forward to seeing what you're going to write in the chat about this week and about what's sticking out for you and what is meaningful. And I would love to hear your thoughts on personality disorders. Particularly, one of the questions that it's always an important question to ask is it personality or is it a personality disorder? Anyways, looking forward to catching up with you in the chat. Hope things are going well, and we'll talk soon.